Good afternoon. I'm Steve McClafferty, Finance Director here at the Vermont Veterans Home. I'm here this afternoon with our Medical Director, Dr. Peter King, to ask some questions about COVID-19 that have been on my mind and what I hear from people. Before I get into the questions, let me give you some startling facts. The world has been living with COVID-19 pandemic for about a year now. Worldwide, there have been over 96 million cases, of which over 2 million people have died from this disease. And with the worldwide population approaching 8 billion people, this means about 1.2% of the world's population has been infected with COVID. Compared with the 1918 Spanish flu outbreak, that infected more than 500 million people, or back then a third of the world's population, and approximately 20 to 50 million people passed away from the Spanish flu back then. In the United States, we have experienced over 24.3 cases, or 25% of the worldwide cases, with over 402,000 deaths, which accounts for just under 20% of the worldwide deaths. In our small state of Vermont, we have had over 10,300 cases and 163 deaths. And in my opinion, 163 too many. In Bennington County, we have had 784 cases and 4 deaths. Still 4 too many. So Dr. King, I have about 9-10 questions here. With the 2 vaccines on the market and being administered, what have we learned these past 12 months about COVID-19?
Well, there's been a lot learned, and it's informed the changes in management, and as anybody who works here can tell you, recommendations has changed throughout the course of the pandemic as we've learned more information about COVID. We know that it's very infectious, and we know, particularly in some age groups, that it's very lethal. Certainly with the statistics you recite, it's readily apparent of the impact that it's had on the world. COVID has really brought the world to its knees in terms of health and death and economy, relationships, how countries interrelate, and with the vaccines coming on board, we've really learned that is how we get out of this. We've learned a lot of measures about how to mitigate it, and everybody is familiar with mask use, hand hygiene, distancing, staying away from others when you're sick. And we practice that with varying degrees of proficiency in our world, and that's reflected in where we see hotspots. And to put just one more factor into the mix, like any virus, coronavirus mutates, and some of those mutations have really no meaning for those of us who are dealing with people who get sick with it, but some of them do, and they can affect how infectious or contagious the virus is, and those are the ones that are being watched the most carefully because they're spreading the quickest. With the vaccines coming on board, the importance is to roll them out as quickly as possible because the more immune our population is, the less the virus can penetrate. And subsequently, if it can penetrate less, then these other variants are much less likely to overtake our population. One of the real miracles of the vaccines, it's been amazing that it's been able to be produced in response to this pandemic so quickly. That's basically because the technology's been perfected over the past 15 years to permit these first two vaccines to come to be available for us. But if we find that the coronavirus changes enough, the experts can change the vaccine and manufacture if it changes enough such that needs to happen. for now, the indications I hear from experts in the field is preliminarily it looks like that there's likely to be good overlap with these other variants with the vaccines that we have now. Of course, with a new experience like the pandemic, we learn a lot as time goes by, both about the disease and about response to vaccines and ways that we need to adapt as a society to minimize its impact on us.
Well, thank you. Why, in your opinion, did this vaccine take such a short time to develop, while other things I read from the CDC and the FDA say it takes years for, pharmaceuticals and other vaccines to come out?
Well, when you throw a lot of money at something and you stop doing everything else, and you change from 5 days a week to 7 days a week to 24 hours a day, it's pretty amazing what you can accomplish. And I'll refer back to something I just said, is that the technology for these first two vaccines has been developed over the last 15 plus years by the National Institutes of Health. So it was a vaccine that was developed on a framework anticipating that a pandemic could occur with a virus like the coronavirus, and all they needed to have was the genetic sequencing of the virus itself. And so that was really the last task to complete before making this virus, the vaccine, available for research. And so that was the miracle. And then just all resources were brought to bear because of the impact of this pandemic.
Yeah. I have a friend who taught at Boston College organic chemistry, and he said the same thing. We've been working on it for years. It isn't just one thing that we just started in January of last year or February. We've been working on it for the 15 plus years.
Right, and there were no shortcuts. The same phase one, which is a very small group of people, it's volunteers that take it to ensure that it's safe. And then phase two, which is a larger group of people to demonstrate that it has some positive effect. And then phase three, which is much larger, and for the Moderna and Pfizer vaccines, that was 32,000 people who ultimately received the vaccine. And out of those 32,000 people that received the vaccine, do you know how many cases of severe COVID there were? You don't, obviously.
No, good. I was going to say, only one?
There was one.
Wow.
There was one case, whereas it was much more numerous in the placebo group. So this has been proven to be these vaccines are proven to be very effective. The threshold for the FDA for an effective vaccine is to work 50% of the time, which is pretty good. If you have a disease that kills 20,000 people a year, if you can change that to 10,000 people a year by the use of a vaccine, you've got a good vaccine. These vaccines are operating in the range of 94, 95% efficacy. So we're incredibly fortunate to have this tool now.
Oh, great. People want to know when we're going to get back to the new normal, and what do you think that would look like?
Do you want the date, or?
Whatever. I mean, who knows?
I know. I mean, certainly we all long for a time which wasn't all that long ago. It's not going to be a flipping of the switch. It'll be driven by how much coronavirus there is in the environment, and we'll be able to relax all this infection control effort that we're doing in response to that. That will go down as we practice these measures and as the vaccine rolls out. Most people will need to take the vaccine for this to get better, and so that's an important thing to know. As Dr. Dobson at the hospital had mentioned, is that given the contagion of this virus, that people who are unvaccinated will likely get will get COVID-19 probably this year, if not next year. Although they may not become symptomatic, they do have the possibility to pass that on to family members or to coworkers or to people they care for. And those people can get sick and die and because of this. And we have an opportunity to prevent that now. So that's why there's such a huge push to get our population vaccinated. If we just sort of tiptoe into it, then the date you're looking for of getting back to normal is years away.
Yes.
If we boldly go where we need to go with this, that will happen much sooner. I mean, people are hoping that people can return to school in the fall. It'll have permanent effects on design of institutions and office space and that sort of thing, because the contagion of the next pandemic, will that wreaked havoc with this pandemic when people were too close together for prolonged periods of time. So under the best scenario, with people taking the vaccine, the hope is that summer people may be able to get together without masks if the community prevalence has diminished. But if we take our time getting the vaccine, then it can be longer, certainly.
Well, you brought up two interesting parts in there, and I just want to ask you a question. I have friends, the wife tested positive, and he tested negative. Is he still susceptible? And the other part of it, if he's not, could he become asymptomatic? And what does asymptomatic mean in layman's terms?
Well, asymptomatic means you have no symptoms. I mean,
okay.
You can get COVID, and then there's the version where you have symptoms. Those can be mild, they can be severe or life-threatening. Or you may get an infection that is without symptoms. So I may feel fine. But even though I may feel fine with my COVID not giving me any symptoms, I can still spread it to others. And if I spread it to somebody else, they may not have symptoms, or they may have some symptoms, or they may die of the illness. And so not having symptoms, you still have the infection, because we demonstrate that by having a test that demonstrates traces of the virus genetic material in the nose when we do the nasal swab. But in terms of the couple, if someone tests positive and then they have it, they have COVID and they have the potential to spread it. The partner, if they test negative, if they haven't been vaccinated and didn't have COVID in the past, then they are susceptible to catching it. And then in that situation, the unaffected partner would want to quarantine, and the person who has it needs to isolate. And there are two different things. Isolation means you have the illness and you're waiting for that infectious period to pass. And for mild disease, that takes 10 days. So that person would need to be isolated from others entirely for 10 days. Her partner, it's actually 14 days, because that has to account for an incubation period. So she gets it, and then say that it takes him 2 or 3 days to get it, and then he has to work through that. And now with test availability, what it is, we would test the person in quarantine to ensure that they did not get the virus.
Okay, good. Thank you. 90% of our veterans and members here received their first vaccine inoculation almost 3 weeks ago, and 60% of employees received their first inoculation. This is a pretty impressive statistic. What do you think was the driving force for such a high participation rate when getting the vaccine is voluntary?
Well, I think our residents are uniformly in high-risk groups and susceptible to the more lethal effects of the illness, and also the chronic effects. A COVID virus is a lung and heart illness, and it can have chronic heart problems as a complication of it, chronic lung problems. It can affect other organs, but those are the two organs that are targeted most frequently. And that's one of the often less talked about aspects of COVID, is people who are left with residual or lifelong results or effects to their health because of having had the COVID. So it's so that's really where we want to prevent that. The complication part of that illness.
Some people I talk with, or they just tell me, they're not getting the vaccine because what are the long-term effects of getting the vaccine? What would you say to those people who are either sitting on the fence or the naysayers?
Well, I've said a lot of things to naysayers, and I spend a lot of my day.
You convinced me I'm getting my second one Saturday.
I know. I'm getting my second vaccine in 2 days, and I can't wait. And I read an article in the New York Times from earlier this week where someone addressed this issue, is that the vaccine may have been undersold because the information about it seems to have evolved into a discussion where we're talking about a minutia, a small issue with the vaccine, and we're losing that it's 95% effective, and it's been given to 12 million United States citizens without serious side effects. And to have any drug that you give to 12 million people without a serious side effect is pretty amazing. So we have that. That's where the focus is. People worry about long-term side effects. None have been demonstrated yet. It's certainly a short period of time, but you would be hard-pressed to think about common long-term side effects with any vaccination. Vaccination programs in general have been really modern miracles of medicine when you think about the elimination of smallpox. There's no longer the generation of people, of kids who are disabled by measles, encephalitis. And we just think about people who don't die of tetanus. I mean, I haven't even had a patient with tetanus in 40 years. And there's widespread tetanus immunization, and our population remains immune to it. So I try to point out, a lot of the things about the vaccine. People are nervous about side effects, but I think that's really, certainly our local experience mirrors the broader experience, is that sometimes people have a minor sore arm for a day, or maybe feel fatigued, or have a headache that was unusual. But these side effects pass in a day or two, and really, we're literally saving the world with this effort. It's important to us to recognize that these side effects are often just a manifestation of our immune system sort of waking up to this foreign, being primed for this foreign invader, so that it can't, march through our population.
Yeah. Personally, that was my side effect. The next day was just a little soreness on my arm. I do recommend for people who do get the vaccine or the inoculation to sign up to the CDC's V-Safe, I think it's called.
Yeah.
You get a text once a day. It asks you 3 or 4 questions, and I think providing the CDC with more data, they can produce more information that about side effects and how it's affecting the population. So I would strongly encourage that when you do sign up to get the vaccine. Why is contact tracing so important?
Well, contact tracing is something you can do when you have enough staff, the public health effort to follow where cases are, where they might spread, and how do we isolate the infection. Because if we can isolate infections and let it run its course without infecting everybody else, we can really close down the circle of people who get sick. So contact tracing is something that we do here, that the Vermont Department of Health has been doing for the last 10 months in following up on cases. When an epidemic or pandemic gets out of control, contact tracing can no longer be done because it's just so much in the community. But fortunately, our region hasn't really seen the devastation that other more urban areas have, or other areas of the country. I think a large part because of the leadership that we've enjoyed here in Vermont has really helped stay on top of what's going on. And a big part of that is the contact tracing. They help us focus on who's sick, who did they have close contact with, and then those folks are quarantined. And then if they come out of the quarantine and they didn't get sick, they're okay and they're good to go. And the affected patient, once they've gone through their period of isolation, they're good to go after that because they're no longer able to spell that. But one thing the health department did was beef up the numbers of contact tracers, because that need became very acute over this past year.
Well, my last question, being a Monday morning quarterback, Dr. King, what, if anything, would you have done different?
It's a hard question because we've done a lot of things differently, and it seems like every couple of weeks we're shifting gears based on new information. I think the emergency preparedness is always something that's a challenge when you're in an industry where resources can be tight, and I think that's, there was a lot of anxiety early on about having adequate PPE. I think we and the rest of the country in healthcare have learned that to have more robust manufacturing resources within our own borders, such that we can control the supply a bit more of PPE, and that we need to think about longer term storage of PPE. We were very fortunate in that we've never had a PPE shortage, thanks to people like yourself and Kim Telford and Darlene Erickson and Al Fax, who recently retired, who spent a lot of effort focusing on our specific needs, including gowns, gloves, procedure masks, and then N95 masks, which we have come to implement here. So I think preparedness from that standpoint. The other side of it is, and I'm not sure exactly how to articulate this, but it's readiness for immunization and vaccination. And I don't know if that would have a different outcome in terms of vaccine acceptance, but it's hard to imagine a safer vaccine being produced to combat something so lethal and not have near universal acceptance. And it's while I think we'll get there, that's the part that I think we may not spend enough time talking about, and that may be an area to have more robust education in, is how fortunate we are to have this kind of thing, and that would really help, because if you have a vaccine and if the logistics to deploy it very quickly, that's how you're going to marshal an end to this pandemic.
Do you think, just as a follow-up question, do you think that people are maybe hesitant because it's a 2-dose vaccine versus I go get my flu shot once a year? And
well, I actually did have one person mention to me that they're going to wait for the 1-dose, the Johnson & Johnson vaccine. And while that is certainly much more convenient, and that would be an optimal choice, particularly if you're going somewhere to a large country, rural areas where it's very difficult to set up follow-up clinics, that would be really beneficial. I mean, here they're coming to our workplace and giving it to us, so the second shot is really not that much of a burden for us. So we're lucky in our setting and our access here.
Well, I just want to say thank you very much for your leadership here to get us through this. Today's a solemn day. A year ago was the first time we had a COVID case in the United States out in, near Seattle, Washington, January 21, 2020. You've led the ship very well for us, and I thank you. The leadership and everything. To at least hopefully we don't have another one, but we'll know. We'll be prepared.
Well, I appreciate your thought, but I truly recognize that this is a team effort.
Oh, yes.
There's been some wonderful silver linings of this. Is seeing the people who have truly risen to the occasion, because this has not been an easy environment to work in. And I would say, the folks that I work with here at the Vets Home, first of all, I've gotten to know them a lot better, one nose at a time, doing all this testing that we're doing every day. But just getting to know people has been a real silver lining, and getting to appreciate, how hard it is to work under this situation, particularly early on, with all the anxiety about not knowing how things were going to unfold for us, for our residents, and our families. I mean, it's just a very, very difficult thing to live through. So I would just say it's it's the team that really helps to do it. No one could do this alone, and the management team, I think, has invested a lot of effort, and certainly that all the staff here have that have come to work during this pandemic have really exhibited dedication to each other, their residents, and our mission.
Well, thank you very much, Doc. I'd normally shake your hand, but nowadays we can't. Thank you very much for everybody who are watching us. All I can say is please go get your vaccine. Social distance, wash your hands, wash your hands, wash your hands, paraphrasing Henry David Thoreau. And be safe out there. And thank you very much.